Information about the conducting capacity of our heart, a physician needs to be able to read the electrical output of the cardiac tissue, and this will be done through placements of electrodes and EKG leads. The electrode is an actual metal plate positioned on the surface of our skin, and that will be used to detect the electrical currents of the heart. Now, the EKG lead will be attached to the electrode and identify the differences in voltage that those pick up or detect. Typically, we discuss this as a 12-lead system, 6 of which will be placed out in our limbs, near the wrists or the shoulders or down in our thigh and ankle, while the others will be placed on our chest, known as chest leads, and these will be numbered according to their placement. The first of these is going to be positioned in the 4th intercostal space to the right of the sternum, while the second is placed in a similar orientation but to the left of the sternum, also in that 4th intercostal space. Now, we know that the body has a capacity to conduct this electrical impulse, so rather than trying to place something directly on the heart, we take advantage of that signal passing through the surface structures in the area. In order to find that 4th intercostal space, typically a physician will begin by palpating the sternal angle, which lets them know that they're at the 2nd costal cartilage. So if I come inferior to that, I'll be in the 2nd intercostal space, and then count down towards the 4th intercostal space. The 4th lead will be placed in the 5th intercostal space near the left midclavicular line. And again, the clavicle is an easily palpatable structure in most individuals and therefore will allow the physician to accurately place the lead along that midclavicular point. The 3rd lead will be placed directly between the 2nd lead in the left intercostal space and the 4th in the midclavicular line. Now the 5th lead is going to be positioned more on the outside of our body, and this will be positioned near the anterior axillary line or anterior axillary fold. And this will be placed in line with that 4th lead more medially. The last of the 6 leads will be placed in the mid-axillary line directly under the midpoint of the armpit. And again, this will be placed in parallel to the 5th and 4th leads. Often, there will be another lead placed on the right side similarly to the V4, again in the 5th intercostal space, but this time on the right midclavicular line. So, using surface landmarks and surface anatomy, a physician will be able to palpate and correctly place these leads to pick up the conducting impulses within the heart to accurately make an EKG signal.